Welcome to the Community Podcast Show. My name is Warrick. If you're new here, my mission is to interview experts in their related fields. And today I have the opportunity of interviewing Dr. Simon Lawson, who's an expert in the sports and medicine chiropractic field. Today we got to talk about what a chiropractor actually does in the first place, why they are important, what conditions they actually treat. By going to a chiropractor, what are the health benefits and well-being benefits of going and having chiropractic care? Dr. Simon Lawson has been a lecturer and is part of the South African Chiropractic Association, chairs the organization, and he's got a wealth of knowledge. Welcome, Dr. Lawson. Thank you for your time, and I'm hopeful you can teach us lots of things today.
Thank you for having me. It's a pleasure and a treat to do this podcast with you.
Well, somebody perhaps has absolutely no idea about the chiropractic industry. They've never heard of it. They may have heard of it, but they had absolutely no idea what it is. Can you tell us briefly in layman's terms what a chiropractor actually does?
I guess we could begin by saying that a chiropractic is a chiropractor and is a specialist in neuromuscular reform therapy. And what that means when we break it down is that chiropractors specialize in looking at your peripheral nervous system, how that integrates back into your central nervous system, and how we can best optimize the function of that nervous system so that your body functions and performs at its optimal. And there are obviously certain structures, whether it's soft tissue, whether it's bone, whether it's ligaments, whether it's organs. There are certain elements within your body that if they're not functioning as well as they should, it can then inhibit or disturb the function of the nervous system. So the basic premise of chiropractic is the belief that if we can create or enhance the functioning of your central nervous system and your peripheral nervous system, you've got a healthy functioning body. The way we do that is by using our hands. So chiropracticos means done by hand. And so all of our therapy is manual, as if we literally use our hands in order to remove any inhibition or distraction or disturbance on the nervous system so that your body can function and perform optimally. Chiropractors pride themselves in the chiropractic manipulation or the spinal manipulation, which is very different to a general manipulation of the spine or any other joint. And we pride ourselves in the fact that we're very particular and very specific about our manipulation. And the manipulation itself is described as a short amplitude, high velocity thrust on a joint, which means that it's a very small distance that we move that joint at a very high speed. And that's where the benefit comes, and a specific benefit comes from a chiropractic manipulation versus a general manipulation. A general manipulation is more of a slower, more of a general release of joints, which you can get if you're lying on your back and you twist yourself one way or the other and you hear a couple of clicks and pops. That would be more of a general manipulation. So chiropractic is very particular and very specific about which joint we manipulate, and the specificity behind that is the effect that it then has on the nervous system. So through our examination, when we're looking at our patients, we try and identify specific areas or segments that are causing the inhibition or the breakdown in the nervous system. Once we've identified those segments or those levels, our adjusters is very particular and specific on how we adjust that segment and restore the normal function and remove the inhibition from the nervous system. That probably sounds like there's a lot of jargon and it probably sounds quite...
Yeah, it's like, and I don't want to unset you, but they're very layman's terms for somebody who's in an office or where somebody's just working hard and has got no idea that, oh, they've got this cause this symptom or frustration. When you talk peripheral nervous system, I mean, that's, nervous system. Like, in very layman's terms, like, I think it's, if you mind taking a step back, I mean, what's the difference between a peripheral sacrum?
So your central nervous system is essentially your brain, and then what they call your autonomic nervous system, which is the system that kicks in subconsciously that allows your heart to beat, tells you to keep breathing, that basically keeps you alive. And the peripheral nerve system is when your brain has sent the message down the spinal cord, that allows you to be able to move your neck, move your arm, grab things, run, bend down. It's your global function, but it's all your nerves and your communication outside of the central nervous system. So your brain is what sends the message initially, where all the thought processes in that conscious and subconscious take place. Once that information gets sent into the spinal cord, as it comes off the spinal cord, that's your periphery of the system. And any inhibition or blockage on that is where chiropractic is hugely beneficial. We do have influence on some of the effects of the central nervous system, and that can help with mood enhancements. It can help with general functioning of your organs, and things like that. But it's more of a, you won't notice an immediate effect on that. As we remove the inhibition of disturbance away from the peripheral nervous system, your central nervous system starts to function better. And then you'll notice a change in your health and well-being. So where chiropractors used to get into a lot of trouble way back in the past, historically, was they would walk around and tell you, oh, I can cure your diabetes, I can cure your cancer. Now, that's not entirely true. We can allow the body to start functioning and performing better, and in turn, improve the performance of your wellness and health and well-being. On that point, what specific symptoms specialists like yourself great at curing? So the basic bread and butter is neck pain, headaches, and low back pain. But chiropractic is incredibly more diverse and more specified than that. But for the lay person, that is probably our base and other standards. If you've got neck pain, you've got headaches, you've got low back pain, chiropractic works incredibly well for those presentations. And as I say, it is way more complex, way more diverse, and way more specialized than that.
Just, as a macro level, for somebody, that hasn't been introduced to your industry.
So the interesting thing is that I think, over time, and just because it simplifies things, chiropractors were always referred to as rhythm club doctors. So you literally went in there, if only you heard a couple of punches, pops, clicks, and can we reach you around the bed a bit? That was chiropractic. And there's such a poor correlation of that versus what we do. Yes, it's easy to put us into a box, and that's what we seemingly used to do, and nobody really understood it. All he knows, you go to the chiropractor, you get a couple of clicks of pops, and whoop, your headache had gone, your neck felt better, your back moved better. I think over time, there's been an understanding and awareness from our profession that we need to step up to the plate and try and explain better what that we do, and it's not simply a clicking a pop of a joint. But there needs to be an open-mindedness or an understanding from traditional medicine, mainstream medicine, as to where chiropractic actually fits in. And we're not quirky and cracky. We don't hang upside down in dark cupboards and roll phones, scans, and things like that. There's a very strong science behind what chiropractic does and its influence that it has on the nervous system and the body's function. The problem comes often in terms of chiropractic is to explain why A plus B doesn't equal C, or 1 plus 2 doesn't equal 3. It doesn't always work like that. The body is fascinating. And I think mainstream medicine is starting to understand that and starting to realize that we can't explain everything that happens in the body. But if we can give the body its best opportunity to function properly, it's amazing what the body does on its own.
On that note, if you had to perhaps speak to a GP, for instance, and explain to the GP what you actually do.
So it's quite interesting because I think we keep going to see a GP for headaches, neck pain, low back pain, sports injuries, whatever it's about. Their tools are pretty limited. They're either going to refer to a physiotherapist, like it is of your chiropractor,
Which one knows the difference between those three, but yeah.
or they're going to stick with what they know, which is probably going to be a course of anti-inflammatories, maybe some painkillers, and if it's really intense, maybe some muscle relaxers. Send you away. If you're not better in a week, 2 weeks' time, come back and see me. So in a lot of ways, if you're going to go the chemical route, which essentially is prescription medication, it may or may not have an influence on your pain pain presentation. Ultimately, it's not going to affect or change any kind of mechanical issue or physical issue that's brought your pain about. It will help manage your pain, your presentation in terms of your symptoms, but it's not actually going to fix the problem. So I think a lot of GPs find themselves in a very frustrating position in trying to decide how best to help their patients. And thankfully, I mean, I've been in practice for just up 25 years, and the change in attitude and perception towards chiropractic has been gastronomical, thankfully. Um, and those practitioners out there who've been exposed to chiropractic and have had seen what chiropractic does for their patients, quite happy and readily send their patients to chiropractors, though, which is fantastic. That's amazing. And the symbiotic relationship that we had with GPs, with neurologists, with neurosurgeons, with orthopods, is just growing and growing. It gets better and better. And the understanding that there is a place for everybody within that healthcare team to try and keep our patients healthy and functional. So GPs who have got a good engagement with their local chiropractor will very rarely say to your patient, right, you're presenting with pain at the moment. Large percentages of this is inflammatory, and I'm going to prescribe you some anti-inflammatories or a painkiller, some muscle relaxers. But in the meantime, I think you should go and see your chiropractor. And we'll obviously do a full assessment and come up with a working diagnosis. If it correlates with mechanical back pain, mechanical leg pain, cervical orientated headaches, things we know chiropractic works very well with, fantastic, you're in the right place. If not, our options are then to say, this isn't really a chiropractic case. I need to refer you on to see a neurologist or a neurosurgeon, or we need to couple with what's going on here with some help from the physio or the biokineticist in order to get you out of your disease or discomfort state. You get you healthy, you get you functioning and talking.
Doc, on that note, please explain and educate us as to what the difference is between a physiotherapist, a biokineticist, therapist, and in your case, a chiropractor. I mean, am I the first person to ask you that, or is
And it is quite confusing, and it's quite confusing because of the way our health system functions in this country. And we are incredibly fortunate on a number of levels in the way that our private health system does work. And our public health system, unfortunately, is very dysfunctional. And hopefully in time that will improve. But let's focus on the private medical side of things, because that's where this conversation comes in. And you've got 4 very different manual therapies that you're talking about and approaches. And in all honesty, there is more than enough work for all 4 of those therapies, and all 4 have their place. Unfortunately, as I said, because of the way our private health system works, and we all tend to probably upset the market a little bit. When you all start moving into circles where there's a lot of overlap with the different therapies. In an ideal world, you'd be able to go to the chiropractor for this, the physio for that, the biokineticist for that, and then the massage therapist if you'd like it. And so tap us through it, Doc. No. Unfortunately, we don't live in that. Oh, right. We don't live with those pink tinted glasses on, rose tinted glasses. So what ends up happening is we try and create a one-stop shop for our patients, which most of the time we'll get away with, but practitioners, and I found practitioners who are established, practitioners who have got enough experience in their field, know when they need to refer on to the next person, where that added input from the physio, the bio, or the massage therapist is going to make a difference in their patient's outcome of the therapy and their treatment. So what you'll tend to find is that, again, we get boxed. If it's joints and bones, go see the chiropractor. If it's soft tissue and pay around soft tissue, that go see the physio. It's not as simple as that. Take us through it. On top of that, it gets more complicated because there are patients who will always resonate much more to physiotherapy, and there's patients that will always resonate much more to chiropractic. And that's their characters, their personalities, their belief systems, all the rest of it. So that aside, let's go and look at those for Bunny. or therapy. So physiotherapy generally is your initial contact in terms of that acute inflammatory condition that happens with any kind of pain. Right. Their goal would be to try and drop the inflammation as quick as possible and try and slowly start restoring some general and function back into that soft tissue. So flushing out the inflammation with some soft tissue work, with some modalities, if they use interferential or they use ultrasound, or whatever modalities they have available to them, the initial phase to try and get that inflammation down. They might add in some mobilization, tilted joint for trying to get the joints starting to move and function a little better, and just generally trying to get that area to start calming down and the function making. They'll give good advice with regards to reducing inflammation, whether it's ice or heat or a combination of those, or compression therapy, whatever needs to happen to try and calm that system down a bit so we can start getting the function back.
And you can't box it like a general fall or a general
No,
walk down the stairs, or you could be.
you can. It just gets more and more. I mean, it's so diverse. And then look, within physiotherapy, there are very specialized fields. There's respiratory physio, there's neurophysio, and those practitioners are phenomenal in their knowledge and their expertise in those areas. And funny enough, there's not too many other professions that would even go into that gray area. They dominate those areas. It's more in the orthopedic, sports injury, and general day-to-day aches and pains field that you start to get this overlap between physio, chiro, massage therapy, biokinetics. That's the hot pot, the melting pot. And so the physio would help initiate with that calming down of the system, trying to start implementing some function and some moving patterns in there. They might add in some stretches, add some exercise therapy. So that's usually early on. What then happens is the biokineticist would then flip in to take over that next phase where you've got that initial rehab kicking in to that mid phase of rehab and end stage of rehab and strengthening and conditioning. That's where biokineticists really hold their own. They have their area of expertise and their specialization. Again, there's a tendency for this overlap where you've got biokineticists that are going more towards the acute phase and they're starting to add in soft tissue work, massage, that kind of thing. And you've got physios who are going more into end phase rehab, strength and conditioning. That's where the conflict starts to come to a physio biokineticist. And I guess that'll be like one of those. I think what is quite a good analogy is the fight on the African plains between hyenas and lions. That might be the size of the story, but there is a lot of overlap there. To the lecturers of all, they both know where their scope of practice is and where they should start and end. But in reality, that doesn't work. So that's an age-old fight that takes place between physios and biokineticists. There always used to be an age-old fight between physio and chiro. I think the physio-bio fight is taking a lot of attention off the chiros, and we're a very small profession. So we're very grateful for the moment that the fight is between physios and bios. But there is that sort of, I wouldn't say conflict, but that's that overlap again between physio and chiro. So chiropractic is a master's degree, master's qualification straight up. We roll over into our sixth year because of our internship and our internship requirements in terms of patient numbers and exposure to clinic practice hours. And when we qualify as chiros, we are qualified as primary contact of care practitioners. What that means to the layperson is that if you got any kind of back, and generally any kind of page, so to say, and generally it would be back related when it's neck, mid lower back pain, headaches, maybe some referral into the shoulders or down into the upper parts of the legs, you should be able to kind of see any chiropractor, walk into their office. They should do an initial consultation with you, a full examination, and come up with a differential diagnosis or a working diagnosis. Now, if that diagnosis falls under the gambit of what chiropractic could treat, the chiropractor would treat you. If it doesn't, they have the opportunity to then refer you to the appropriate healthcare practitioner. Now, what that means is chiropractors are taught to diagnose and be able to refer appropriately. Physiotherapy doesn't do that. Physiotherapists are not taught to diagnose. They start to diagnose through their experience once they're in practice. That doesn't mean you're a diagnostician. So and again, it's because of the lay of the land of our private health system that most people refer themselves straight to the physio. Now, if it is a musculoskeletal condition, the physio will treat you primarily, and they might treat you for a treatment too, and go, hold on a second, I don't like where this is going, I need you to see a doc, or I need you to see a specialist, or whatever the story is. In essence, the chiropractor, once we've examined you, should be able to say straight up, listen, this is what you've got. This is what we diagnosed you with. This is within our scope of practice and we can treat you, or actually, I need you to go and see your GP for this, or I need you to go and see a neurologist or a neurosurgeon because this is where we think going. Or we can then refer you for further examination or further testing. So send you for x-rays, send you for blood tests, send you for an MRI if that's what you want. To add to the picture to then make the appropriate referral. So the biggest distinguishing factor on a musculoskeletal level between physio and chiropractic is that when we've qualified with our master's degree in chiropractic, we are diagnosticians. So we can diagnose you and then treat you or refer you appropriately.
Learning how to do any of those fields. Just to give context, like the physio, is it 2, 3, 4 years versus a bio? I can't. So, but there's your ability.
So physios do a 4 years honors degree.
Okay.
And then they can go out and work in private practice, or if they want to get involved in the public sector, the options or opportunities are there. And you can do a master's in physiotherapy, which then becomes a bit more specialized. So they would choose a direction that they want to go within physiotherapy to focus on that. So you can do your master's in manipulative therapy as a physio. You can do it in respiratory therapy. You can do it in neurological physio. And so those options are there to do a master's degree, but that would be post your undergrad qualification. Unfortunately, within chiropractic, and it's changed now, but there's no drop-off point. So once you start studying chiropractic, you're in for 5.5, 6 years. They have changed the curriculum now, so that after your bachelor's, you can switch track and you will get credit for your subjects. There's no such thing as a bachelor's degree in chiropractic, unfortunately. So if you do choose to leave after 3 years, you still get all the credits for your subjects, and then you can change track. You can then do your honors. That's similar sort of thing. There's no honors degree in chiropractic. You'll get credit for your subjects, and then you can change track again. You will only get your full professional qualification once you completed your master's and completed your internship, which involves a research component of your master's. And so on an academic level, on a qualification level, that's the essential difference between, and let's be specific, because if you're going to compare physio and chiro, it's probably 9 times out of 10 and be on that orthopedic level or that musculoskeletal medicine level. Okay. Then there's obviously glaring differences between our approaches and our treatment modalities with physio and chiro. Chiropractic, in essence and essentially, is the use of our hands, and we use manipulation of the spine to elicit changes that we want to elicit on the nervous system. And manipulative therapists, manipulative physiotherapists, we use mobilizations to try and elicit the same response. But chiropractors will tell you that the essence and the significant difference between the two is the effect of the manipulation versus the mobilization. And it's the speed and the amplitude of that manipulation of the spine that has the biggest effect and the biggest input on your nervous system that elicits the quickest and the most effective response. And we pride ourselves in that as chiropractors. And there are a lot of manual therapists out there that will go and learn how to do manipulation. And as I've alluded to in the past, you can get a general manipulation or a very specific manipulation. And chiropractic is very much about that very specific manipulation to a particular joint at a particular angle and particular speed that is the biggest response.
Wow. Okay. So on that topic, you are very specialized in sports science, medicine, chiropractic field. So I'm just curious to know, like, perhaps somebody's a good chiropractor versus now over 2.5 decades that you've been specialized in sports, like with the same sports injury. I'm curious to know, like, what, why would somebody with a sports injury come to you opposed to a normal chiropractor? Like that differentiation, what, like, yeah. So then I also said, it's like,
So obviously my undergraduate qualification is in chiropractic, uh, and that's the foundation of what I do on a day-to-day level. So going to see any chiropractor, you could box it again and say that chiropractors just look at neck and back and the influence that the manipulation has on the nervous system and the spinal cord to this a function in the body. Raw essence, that's what a chiropractor does. My passion and my interest and my area of specialization has been sports medicine, sports injuries, which brings in all your peripheral joints. So now we're looking everything away from the spine. That doesn't mean that I've lost interest or I'm not specialized, but I'm more fascinated in the effect that any kind of disturbance of the central spinal stuff has on your peripheral joints and your functioning of your arms, your legs, knees, ankles, hips, shoulders, elbows, and wrists. And so when you come to me as an athlete or as an active individual who's picked up an injury from any sport related sport, any kind of sport related, and you may come to me with a specific injury. Okay. Obviously, there's injured tissue that needs to be repaired, needs to heal, needs to be strengthened and rehabilitated. That you could get from a physio or from a sports chiropractor. But the question is, how did you get injured in the first place? Is it a traumatic injury, like it was inflicted by a ball or a bat or some kind of object that's inflicted injuries to the tissue? In which case, it's fairly self-explanatory, and we just need to try and fix the tissue, get the tissue healed up, and it's performing properly again. If it's not, and let's say, for example, a 100-meter sprint, she sprints all day, every day. And that's what they do. That's their profession. They're elite.
Mitch, you've got vast experience in that Olympiad action.
How does a randomly one day in an event or in trailing pull up 3/4 of the way through the 100 meters with their hamstring during a cook? What's happening? Or does the muscle just decide, like, today's the day and I'm going to blow up on you? Doesn't work on it. So what has changed? Is it a mechanical change from where the hamstring attaches to where it inserts? Is it communication from the brain or the nervous system that's changed that creates the mismatch between what brain thinks that muscle is doing and what actually comes out of that muscle? What has changed to create that injury? And if we don't work that out and we don't correct that change, we can go and fix that hamstring. We can go and smooth out the muscle fibers. We get the inflammation to drop. We can improve the strength pattern by doing all the exercises that we do. Chances are that athlete's going to get re-injured because we haven't changed the mechanics. We haven't changed the neurological input. Is that us? So one element of what I focus on is to make sure that functionally the communication from the brain through the nervous system is optimal, backs that muscle. And yes, we help repair the muscle, do all the soft tissue work that you need to do. If I'm in an environment, a team sports medicine environment, where there's a physio, there's a massage therapist, there's a biochemist, we can all work together to get that athlete back up and running as quick as possible. Within a practice situation, if there isn't physio available, or a massage therapist or a soft tissue expert that you can work with, you end up doing that work as part of your treatment protocol with effort. And that's fine. Now, we will go through that process. We know how long it takes for the muscle to heal, and we can speed that up to a certain degree. But if we haven't restored the mechanics and the neurological patterning backs that muscle, that effort is going to get re-injured. Okay. So that's for one scenario, and that's probably the most common scenario. The thing that absolutely fascinates me and where I had an expert passion and often the value add of chiropractic within that sports medicine team is missed is what we can do in terms of performance enhancement just by making sure that the nervous system is functioning. So through our assessments, we can pick up if there's disturbance or inhibition on that nervous system, which might decrease the performance or output of that muscle, which then renders that athlete susceptible to injury. That athlete feels fine. That, in fact, 9 times out of 10, that's the athletes that's going to say to you, Doc, I'm on top of the world at the moment. I'm firing all cylinders. I've never felt better. I'm the top of my periodization. I've done all my strength training. I'm doing my drills. I've never run better. That's the athlete that's below the edge. And we need to make sure we keep an eye on that athlete, that we do the tests and make sure that that nervous system is also firing optimally. Because it's usually through that loading pattern, when they get to their optimal level, that the body's taken a few knocks and a few bumps and whatever, and might not actually be firing or functioning as optimally as the athlete feels it is. Now, if we can pick it up before the athlete gets injured, isn't that a win-win? We now don't have that athlete on our bed for 10 days, 2, 3, 4 weeks while we're trying to rehab and correct that hamstring injury. And that, for me, is ideally where sports medicine needs to be. We can all treat injured athletes. We can all get them back in 4 to 6 weeks. And we can strengthen them up and make sure that hopefully they don't get injured again. But we should be at good functioning at a level where these athletes are not getting injured. They shouldn't perform optimally, and we should be able to keep them at that optimal level without them coming off the top of their periodization and getting injured because there's this overload in their system. And that's the area that I find so fascinating. And I honestly believe that that's where chiropractic has the biggest value add when it comes to being part of that sports medicine team. Often, when we speak to the chief medical officer or the head of sports and performance for an international sporting federation or for sports team, I say, well, why would I choose a current anterior physio as part of your medical team within the travel seat? I said, well, it's not a question of choosing a chiropractor over a physio. The physio's role is very well defined, and they bring huge value add to looking after those athletes, particularly if they're injured, particularly if they're sore. But if you could bring a chiropractic in who can help with a lot of that stuff, if there's a massive load of athletes coming through in that team and need that injury repair and rehab, but bringing the chiropractic in gives you the added performance enhancement that hopefully will stop a lot of those athletes getting injured in the first place and enhance their performance so they're performing optimally when you are away and traveling, or you're at the Olympics or the All Africa Games or the regional games or whatever the event is. And I think often that's the message that doesn't get across. And that's the value add that's been missed in terms of having a sports chiropractor as part of your medical team that's traveling you throughout these efforts.
What fascinates me about, and very specifically, you being in sports, chiropractic, sports specialist in sports injuries, it's the difference is going to, perhaps to do a sports injury, going to a normal chiropractor, they may, after 2 or 3 months, be treating a patient for a sports injury, but then the beauty of somebody like yourself, an expert who specializes in that, within one consultation or 1 or 2 treatments, it's like, no problem. You just do this and this and this. That's my experience, the difference between a normal person, respectfully in the industry, opposed to somebody like myself who specialize. That ability to pick up problems very quickly. And I guess, just experience that firsthand. It's just,
And to be fair, I mean, that's not unique to chiropractic by any stretch of imagination. That's the same in any profession, and particularly healthcare. The difference between a general surgeon and a neurosurgeon, or a orthopedic surgeon versus a neurosurgeon. I mean, don't get me wrong. Okay, if I break a bone, I'm there straight to the orthopedic surgeon. But when it comes to operating on the spine, I'm probably going to lean very much more towards the neurosurgeon than the orthopedic surgeon, with all due respect. And it's those nuances and those areas of specialization that make the biggest difference when it comes to something as specific as that.
Doc,
Tell us, what is the main goal of a chiropractic adjustment? So I guess initially it's identifying the segment that we need to manipulate or adjust, and to identify where the breakdown, dysfunction, or inhibition on the nervous system is coming from on that segment. Once you've identified that, you know which segment you're going to adjust, which direction will need to adjust it, and how much force or amplitude you need to add to that adjustment. The ultimate goal of that manipulation or that adjustment is to restore normal function to that segment. And then by restoring normal function to that segment, you remove the inhibition and dysfunction that's occurring in the nervous system. So it stems right back to chiropractic philosophy, way back when, off the back of the English bone setters in the 1600s,
sure.
where there was a branch in terms of professions. Osteopaths believed that by manipulating the spine, your effect was on the great vessels of the body. So all your arteries and veins, and if you opened up your arteries and veins, you could get blood flow to the tissues and you would have a health of the function of the human body. Chiropractors drew the other split, and they believed by manipulating the spine, or with the joints of the spine, your ultimate effect was on the effect on the nervous system. And if your nervous system was inhibition free and could communicate freely to every tissue of your body, you had a healthy functioning human body. So the philosophy and the actual belief chiropractic is that by removing a kind of inhibition, particularly around the spine, on the nervous system, we can restore function and normal health to tissues around the body, whether it's a muscle, an organ, a ligament, joint capsule, whatever it is. If the nervous system is able to communicate from the brain to that tissue, your body can deal with its pain, and it can restore health, and it can maintain function at the faults.
Are chiropractors medical doctors?
So no, we're not. And our first couple of years, our first 2 years, probably covered most of our pre-med subjects. So we would, if you were to have a look at the curriculum, probably pretty much on par with what they study with medicine. And sort of halfway through our third year or during our third year, we start to do more clinical subjects pertaining to chiropractic. So we start to branch away from basic medicine and basic pre-med subjects and start to become more specific in terms of our chiropractor. We are taught to diagnose, and we are taught pathology, which is also part of that pre-med and the build-up into more specific subjects in medicine and in chiropractor. And bottom line, simple answer, no, we're not medical doctors. Yes, we are taught to diagnose. And in this country, because of our training and the qualification that we get and the level of qualification you get, we are permitted to use the title doctor. So similar to vets and dentists, we can use the title doctor, but we may never purport ourselves to be a medical doctor. And in a situation where a chiropractor was to arrive at, say, a first aid situation, someone's injured themselves or having a heart attack or whatever, it's imperative that a chiropractor actually identifies themselves as a chiropractor and not as a medical doctor. And
Interesting. So if you're in an airplane and you're the only doctor, like, could you still help somebody? I'm sorry,
in terms of being able to help somebody in a first aid situation versus Joe Soak who's on the airplane, absolutely. We've got training up to a certain level where we're pretty advanced in terms of first aid. Am I a medical doctor? No. Am I specifically trained in how we deal with someone having a heart attack, having a stroke? No. But yes, we can try and stabilize the patient and get them to a position where hopefully, if it's not on an airplane, hopefully we've had a chance to call in people who are more specialized who can come and then take care of evaluation. Well, in terms of initial contact, first aid, stabilizing the situation, we would 9 times out of 10 have more qualification and experience than certainly your Joe average or someone who's just in the first aid course. So as long as we identify that we are chiropractors and we're not medical doctors, we can come and help and certainly help that patient, stabilize that patient until more specialized help arrives.
Doc, take us through the process of how a typical chiropractic session with a patient typically is from start to finish. The process.
So, look, one of the beauties of our profession is that you can go and see 10 chiropractors and probably get 10 different versions of the same treatment, and we're all aiming for the same outcome and the same response, but we probably have slightly different ways of going about it, which I always find quite fascinating because the majority of chiropractors in this country would have only studied in one or two institutions, and yet there's so much diversity in terms of how we approach our patients. And I honestly believe that that's a very strong thing to have within your profession. But when it comes to actually selling or marketing a product to a patient, that becomes quite difficult. Because if one chiropractor is completely different to other chiropractor, it's difficult to say to a patient, oh, you need to go and see a chiropractor. To put you all at ease, the actual delivery of what we do as a chiropractor in terms of manipulation is pretty much exactly the same. Yes, you buy experiential variance within that, but how we get about it, how we get to it, and how we deliver the adjustment is pretty much exactly the same. So keep your mind at ease. You will get the same treatment. Essentially, it might not look the same. So I can only speak from my experience and what you would experience if you were to come into my practice. And essentially, you would get greeted by a receptionist and probably wait at reception. I would come through, say hello to you, and we walk through to the treatment room. The minute you get up and you start to walk, I'm already looking at you and see how you're moving, how fluidly you're moving or not, and starting to maybe identify or guess what you come to see me for today. And whether it's directly on the money or this is a byproduct of whatever pain you're going through that's causing you to move badly or not as smoothly as you should, I'm already processing that. And we'd have a little chat on the way through to the treatment room. Once we get you into the treatment room, if you're appropriately dressed and your movement is not going to be inhibited by the clothing that you're wearing there, fantastic, we can get started. If not, there's gowns and shorts that are available. Patient gets changed so they're comfortable and we can go through the movement happens immediately. And once we're ready, I will generally do a general screen with the patient. So I get them to bend forward and backwards, side to side. You get a general overview of how they're functioning, how they're moving. Do a couple of functional tests in terms of standing on one leg and the other leg, standing on your tiptoes, maybe doing a squat, trying to see functionally how you're behaving. And in that time, I'm asking questions: how are you feeling? What are you presenting with today? How can we help you? All those sort of things. So we're starting to narrow what we need to focus on.
I'm very before you go, Doc. I'm still trying to, which I'm blown away. Just by seeing somebody walk, you can immediately say, okay, that perhaps this joint, this, just by them walking.
Just by their mercurial isn't he getting up out of a chair? How easy do they get up out of the chair? How do they get up out of the chair? Are they able to just stand up and go? Or do they got the energy of their legs to get them out of the chair? All of that stuff starts giving you information straight away in terms of potentially what are we looking at you. What's going on with this patient and why are they presenting this pain? Potentially, where's the pain coming from? So all of that stuff is already inherently going on in terms of your diagnosis, your assessment for this patient.
Even you mentioned tippy toes, squats. So but just by doing that, a certain way of somebody stands on their tippy toes or does a squat, you can pick up there's certain muscles that perhaps are underdeveloped or are just from
100%. So, wow, how quickly they can go up and down, how well they control it. Do they need to come a splint? Are they really just getting off their tiptoes? And all of those kind of things all start giving you information that we now need to start putting into our clinical examination, clinical assessment. So once I've had a general look at how they're moving or not moving well, get them onto the bed, and then we'll start doing our orthopedic tests, some peripheral neurological tests, and a few other muscle tests in that we do to try and identify where the breakdown in the function and the the movement patterns are coming from. That will give us more of a clear idea and more specific idea of what we need to look at. So we're going from this very global picture from the minute you stand up or start walking, and we're trying to narrow it down to pinpoint exactly where this breakdown is coming from or this dysplasia is coming from. And we might want to do a little bit of like a called motion palpation, which chiropractors do, and we go specifically onto each joint of the spine and try and find out which way those joints are moving or not moving, or where we can pick up restrictions or blockages in the spine.
Which in most at a later stage we can go in real depth, which you're very clued up with that. But yes, is it very briefly?
Yeah, that's very so again that becomes more specific. And then as I say, with a few muscle tests and a few neurological tests, we can then start identifying a specific level where the dysfunction is coming from. Now, a certain level has a certain nerve that comes off. That certain nerve innervates certain structures, whether it be an organ, whether it be a band of tissue, stem tissue, or muscle tissue, or an area around the joint. And you might find that there's a breakdown in communication from the spine on that nerve to that tissue, or you might find that there's a referred pattern either coming off that nerve or the tissue that nerve innervates that is creating the pain pattern in the patient.
And you can pick this up just from your hands, from feeling,
From the tests that we do and the clinical examinations that we do, or blood tests, or so. If we're not certain what we're picking up clinically, and we need more information in terms of what's going on here, then we'll refer for blood tests, x-rays.
so you actually notice, I know had to look something to the blood. So they just MRI can understand skeletal, but yeah, by looking at blood, what just out of for fine facts, what just by looking at blood, what?
So there's a lot of information out of blood tests.
But for you specifically, with
So back pain is not always mechanical in its origin. In other words, it doesn't have to come from a physical tissue pertaining to the spine. If there's some kind of disturbance in your system generally, and whether it's neurological, whether it's vascular, whether it's more respiratory, your body can give you that message by creating back pain. And a lot of stuff presents in terms of back pain. And again, doesn't have to be mechanical. In fact, there's a quite large percentage of back pain that's got nothing to do with the spine at all. But that's the body's way of saying, hello, there's a problem here, we need to address it. And that's why it's so important that the clinical examination and assessment is done thoroughly, and then the diagnosis is made. Without a working diagnosis, you don't know what you're treating. And the only way you can come up with an accurate working diagnosis is if you have a thorough clinical examination. Sadly, these days, and this is broad spectrum, right across all professions and health and healthcare, is our clinical skills are getting less and less and less accurate. But we're becoming more and more reliant, unfortunately, on blood tests, X-rays, MRI scans, ultrasounds, and ECGs, EMGs. All of these tests, which have their value if it relates back to clinical examination. If your clinical examination indicates that we need a bit more information in terms of what's happening here, the most appropriate intervention is a CT scan or a blood test. There you go and do that test. And the test needs to corroborate what your hunches are in terms of your clinical examination. Unfortunately, what's happening these days is our clinical skills are getting less, and we go, oh, don't know what's happening here. Let's send you for an MRI, CT scan, and a blood test and see what pops up. That's like taking a fistful of darts, throwing them at the dartboard and hoping something sticks. It's poor meds. It really is. It's poor healthcare. Our clinical skills are imperative. The better your clinical skills are, the more you narrow down the scope, and then you should be using your special tests or additional tests to confirm your suspicions of what your diagnosis is.
Doc, in the chiropractic industry, why is there a cracking sound when you make a spinal adjustment? What?
So it's a good question, an interesting question. There's a couple of things that can cause kipping and popping in and around the joint. there might be this tight soft tissue, there could be a ligament, there could be a tendon, there could be a little bit of scar tissue on the joint capsule. Anything like that can cause a clicking or popping sound around the joint as it moves. As that tissue runs across the lesion joint, it can cause a clicking or popping sound. And that's generally reproducible. If you can get someone and they say, why does my joint click? And you can do that, and every time you bend your finger, it clicks. Chances are it's one of those tissues that are causing it. And so that's one reason for clicking and popping. And you could just be what they call hypermobile or hyperflexible. And what happens then is that the joint actually moves beyond a normal physiological range. And then people who genetically had this condition. And as it moves beyond the normal physiological range, you might get the capsule releasing, or as I'll get onto shortly, a release of gas within the joint, which will give a clicking or popping sound. Okay. The clicking or popping sound that is the release of the gas bubble is often what you'll hear when we have a chiropractic adjustment. Okay. Typically what happens with the chiropractic adjustments is we'll take the joint to its physiological range on the joint capsule, and then the release comes when we go slightly beyond that. And basically, the speed of the chiropractic adjustment will cause that release of that gas bubble. So as that gas bubble releases, we get a click or pop. That gas bubble releases into millions of tiny bubbles, which releases pressure on the joint, and in principle allows us to get the joint back into a more functional range of movement and a functional position. The principle is that it takes about 20 minutes for that gas bubble to reform again. As it reforms again, it reinstates the pressure on the joint, keeps the joint in its more functional position. The reality is it probably takes 2 or 3 adjustments to get to stick and hold. But that's the click or pop that you hear with an adjustment. So you can elicit that as an individual. You can go and click or pop your fingers, and you can click your finger. Now, do it again. It's not going to click. Give it 20 minutes, it'll click again. So that's what happens in terms of that reinstatement of the pressure and the reinstatement of that gas bubble in the joint. Okay. So that clicking or popping is generally that release of pressure from the joint. The interesting thing is that that's become associated with the chiropractic manipulation. And to be fair, psychologically, the patient and often the chiropractor get a huge amount of satisfaction by the fact that something's stripped apart. That's not the essence of a chiropractic adjustment. The biggest input and the biggest effect that we had as a chiropractor on the chiropractic manipulation on the joint is the neurological stretch that takes place on the joint capsule.
Whether there's a click or not, it's a effect.
Oh, there's actually here.
So it's not as if there's a click, it's a better adjustment, they're not getting a click. That's a misconception, if you will.
And people and it's that resetting of the neurological information around the joint capsule that has the most profound effect on your nervous system and allows that refunctioning to take place. Yes, mechanically, if there's a restriction on that joint, we all get quite excited when there's a click or a pop, because then we know that mechanically that joint is in a better position, and you can go back and test it. And where there was a block or a restriction on that joint initially, now it moves nicely again. And that can still happen without the click or pop. But as I say, we all get quite excited and give it and the element of satisfaction when we hear the tempo. But it is one of my worst nightmares is when I have a patient who walks in, lies down on the bed, you do your first adjustment, you get a nice click, and they go, what?
What do you mean, what? Well, that's one good adjustment. And then you did the thing where they go, 2.
Oh, geez, this is not going to. So it's actually probably a misconception. It's a big misconception. As I say, I think psychologically we all get a satisfaction out of a Kindle pop, but that's not an indication of whether that's a successful adjustment. It's like buck out.
Doc, can you adjust any joint in the body, or is it just the spine specific?
So any joint in the body that has a capsule, which has synovial fluid in it, which pretty much every joint has a capsule synovial fluid. And obviously as that gas bubble, which gives the pressure in the joint, every single one of those joints, you can cavitate. When I say cavitate, that's the kick that you get. And so as a chiropractor, our focus is pretty much the spine and the joints that pertain to the spine. You could probably throw in the rib attachments there as well as being fairly central. There is postgraduate training that teaches us how to adjust peripheral joints. So once you go away from the spine, all of those joints we're taught how to adjust. And specifically, when it comes to sports chiropractic or sports injuries and sports medicine, it's imperative that you have that additional training in terms of extremity joint adjustments. And there are upwards of 360 joints in the body. And yes, we can adjust.
And you've done every single one of the one of the.
It goes further than that because we can also adjust sutures or what's the best way to describe it? Sutures probably the best way to describe it. So even your scalp, for example, where the different components of your skull come together. In terms of when you look at a skull, it's one bone, but there are sutures where, as a child, as you grow, and those pieces of bone come together, and in essence have fused together. In a living human being, those sutures do move slightly, and through certain kind of adjustment techniques, we can realign those and get those better aligned and functional better.
And how would that benefit? I mean, talking very specifically.
Very specifically, and a lot of those cranial bones or cranial joints can be adjusted as well. It is not what you would experience in terms of getting your neck adjusted, the reverse back adjusted. It's a very, very different technique. Often it's associated with what they call sacro-occipital technique in chiropractic. You get cranial therapists who do it as well. So very gentle, very supple moving patterns to realign those sutures in the skull or any of those cranial bones. The effect of that is massive once you get that function back and the alignment back. But don't be confused with what you get when you manipulate the spine or extremity joint. That's very difficult. It's very supple. It's more of a mobilization and more of a persuasive technique to get those sutures realigned. So they'll offer treatment for you. So I do a little bit of that. It's not sitting on an area that I specialize in. But
Like this year, have you?
so I'll add it in as part of a treatment protocol, as an addition. If I notice there's a significant discrepancy in the sutural alignment, or there's something grossly obvious in terms of cranial alignment and things like that. I use it a lot when it comes to sinus treatments and people who are really battle to get their sinuses cleared and get the better function with, like there's a lot of cranial work we can do to loosen up those cranial bones and get better alignment and function in terms of sinuses and the bones of joints around the cranium. So I'll incorporate that into my treatment protocol.
Are you talking about sinus and you can treat that? Like the cause of sinuses, what's it from? Like mucus sinus? Is it? It's a diet or what? Just a fun fact. I mean,
It's super multifactorial. But from a mechanical perspective, if for whatever reason those sinuses contract, and whether it's because you've got a deviated septum or there's been a malalignment in your cranial bones that now blocks the drainage coming out of the sinus.
so what isn't telling you with your body?
So and the minute you can't drain those sinuses and you get an infection in there, you're in a world of trouble. And there's a number of cavities that make up your sinuses. It's not just kind of there or just there. There's some very deep sinuses as well. And often people really suck where they suck a six and get a deep infection and it just doesn't drain. And obviously as that infection builds, the pain and the discomfort and the dysfunction that comes with that is often debilitating. Headaches, chronic infection, particularly in the cranial area, is really debilitating. So we can assist in trying to help with the realignment of a lot of those cranial bones and hopefully help in trying to get some of the drainage to open up. I work very closely with a number of ENTs and interestingly, schizophrenic therapists who can battle with sort of middle ashes with biliary infections and sinus infections. We can actually contribute to pallible in terms of restoring better function and better alignment, coupled with the ENT's treatment or coupled with the speech and hearing therapist treatment. We can actually help drain those sinuses and get those people feeling a hell of a lot better again.
Speech and hearing, that lies for mine. I mean, chiropractor can incorporate, well, Hey, that's
Sorry, very much so, and not just the mechanics behind what happens in and around the middle ear, but there's also a lot of obviously sensitive neurological structures and the impact that certain neck conditions or cranial conditions can have on that middle ear can influence hearing, balance, speech, all of those kind of things. So if we can help from a neurological and mechanical component, and the speech and hearing therapists can be far more with that patient than if they're backing against those mechanical and neurological conditions as well.
Do you currently have any patients that are into sport and they have like hearing aids and they come see you specifically with the
As I say, I work up closely with a lot of ENTs. And so I do see what a
ENT? Forgive me a bit, this. So, no, tire versions.
so often they'll need corrective surgery, which the ENT takes care of. They will also medicate them to help reduce a lot of the infective stuff that is going on there. And then obviously as a chiro, we come in to help with the upper cervical mechanics, approach, and obviously the cranial alignments and function as well.
Is chiropractic more about pain relief or long-term wellness?
So I think the majority of patients would come to a chiropractor because they're in pain. So the alarm system's going off, the body say, hey, I need a bit of help here. And the majority of patients who would certainly come to us as new patients are coming to us with a specific issue, and it's usually pain orientated. So the initial touch point, the initial contact is probably driven by pain. And thankfully, more often than not, our intervention gets great relief almost instantaneously. And obviously it depends what the patient's presenting with, the length of the condition, the symptoms, etc., that they're presenting with could dictate how good a relief they will get from the initial contact. So considering that they would initially come in to us with a specific symptom, which is more often than not pain, that would be the focus to begin with, is to get them out of pain and just start getting them functioning properly. What we then do is once we're out of the red zone, is to now try and get the body back to a position where it's able to look after itself and function on its own without the assistance of coming for regular treatment. And I think certainly the misconception is once you go see a chiropractor, once you've been to see them for the rest of your life, that's your decision in terms of your health going forward. And where the question comes is, does chiropractic help with general wellness? So initially it's an intervention and engagement is to get you out of your emergency zone, get you out of your pain, and get you functioning again. Because we all live incredibly busy lives these days, generally, the minute we're out of the pain zone, we're like, I'm fixed. Good. You're amazing. Took 2 treatments. You're the best chiro in the world. Cheers, I'm gone. Guaranteed that patient is either coming back within 6 months, or 6 weeks, 6 months, or a year.
Wow, why do you say that, Mo?
Because we haven't fixed the problem. So a really good analogy is to look at an iceberg. Okay. When you present to your chiropractor in pain, the stuff that's sitting above the water is what you're presenting. Very quickly, we can take the top off the iceberg. Now all of a sudden your pain's gone. And you said, this is amazing. 2 treatments, I'm golden. But actually the reason why you had the top of the iceberg and you had the pain was all that stuff that sits below the water.
That's a very interesting analogy. So, top of mind, a couple of things that iceberg is. Is it, are we talking posture, way we walk? Like what is it?
So more often than not, what's led to your pain is not that bending down to pick up the paper clip or twisting around in the back of the car that brought on your pain. That was the last straw that tilted you over the edge. So we can reverse that fairly quick and get you out of the pain zone. But the chances are, give it a couple of weeks, couple of months, having not changed anything, you're gonna reenact the same issue. So as part of our assessment, every time you come in, and your chiropractor should be assessing you every time we come in, or your therapist should be assessing you every time we come in, to see how well you've responded to the last treatment and to see whether your body is holding what we're doing. If your body is holding, then you actually don't need to have that treatment. But we'll reinforce what you did last time and say, great, it's been 2 weeks. You've been pain-free. You're back to gym. You're back to doing all the things you want to do. We're now going to push in 4 weeks. Let's check in 4 weeks' time and see whether your body is still holding everything you're doing, considering what you're doing in your life. And the bottom line is, firstly, and the biggest one, we were never designed to sit. And most are spending a lot of time so they know that. Every time you sit for more than an hour, your body is closing in on itself. It's taking strain. It's taking load. That's one example. You're exposed to chemicals every day in your environment. You're exposed to stress, whether it's your home environment, your work environment, just your day-to-day stress. Super things that you might eat that gel with your body or don't gel with your body. If it doesn't gel with your body, you're really putting load and stress back into your system. Are you working too hard? Are you exercising too much? Are you not exercising enough? Are you drinking too much? Are you smoking? All of these things have a massive impact on your body. And how we get through a given day is absolutely amazing. Our bodies cope with what we throw at ourselves every single day is a phenomenal feat. That's without throwing any other stress and strains off. To your car in the morning and trying to get to work, dodging taxis and traffic lights and potholes, all that stuff. Welcome to Africa. Low shits in the roof.
So, Dov, on that note, sorry to interrupt, but I think it affects a lot of people. But when we talk, we all know smoking, drugging, bodying, what have you. But like, at, with all your experience of years, or had heard it all, and like when you talk smoking, like just give us a rundown when it comes to drinking and smoking, and what does it actually do when you start hitting your 40s, 50s, 60s? Like it's cool to smoke when you're at school, but at your level with your experience, like what are some takeaways that you can share that would help?
I mean, like in the broad sense of all of that, and we all know what the risks and the dangers are. And we've been told that ad nauseum all the way through our lives. And yet there are those of us out there who still choose to do that, even though we know the risks. And it often,
But are there specific things that you pick up in your industry as a byproduct of?
so you have to, so I mean, yeah, whatever our reasons are for doing it, whether it takes the edge off our lives, it makes us feel more comfortable, gives us some euphoria, it helps us cope with our day, whatever the reason is, you know that you're putting toxins and chemicals into your system, okay, which your system doesn't cope well with. Now, your body will do a great job at trying to get rid of that, to detox as much as it can, and get rid of that stuff over time. The byproduct of us not being able to do that is that we create inflammation in our system. Okay. And that can spread. It's not just alcohol. It's not just smoking. It's eating foods that are bad for us. And it's um, exposing ourselves to too much stress. It all falls under the same category where we start to create low-grade inflammation in our system. Now, in our joints, in our bones, just anywhere in our body. So any tissue in your body can start to generate this low-grade inflammatory response. On a day-to-day basis, you would never even know it was there. You function quite merely. Every single one of us has a certain level of inflammation or is already get that. And over time, that low-grade inflammation that sits in our tissues causes degeneration. And the best analogy to that is a little pool of water that just sits where it is, whether it's in your garden, whether it's on your roof, wherever. If that water sits there for long enough, everything starts to decay and everything starts to degenerate. And it's exactly the same in our human body. When that low-grade inflammation sits, whether it's in our joints, whether it's in our arteries, whether it's in our gut, wherever it is, if it sits there for long enough, we start to degenerate. And it's that period of time, 10 years, 50 years, 20 years, 30 years, 50 years. The longer it sits there, the more it degenerates, the more it decays. So low-grade inflammation over a long period of time in our arterial system creates those plaques. Those plaques then lead to arterial disease, get strokes, heart attacks, whatever the story is. If it's in our gut, we get inflammatory gut disease or inflammatory bowel disease. and our gut starts to break down. And we started to understand that our gut health is probably one of the most critical areas that we never really spend much time focusing on. The better your gut health is, by and large, the better your general health is. If inflammation sits in your joints, you get arthritis. Arthritis is arth is the joint, and then itis is the inflammation. Arthritis, in a long period of time, these degenerative changes get chronic degenerative disease in the joints. That's where you get everything that everybody hates is osteoarthritis. All of your autoimmune diseases, they all have an inflammatory base to it. And if it's there for long enough and the decay is bad enough, you become disease. And that's when our body starts to break down. The minute you reach a diseased state, the only thing you can possibly do is help manage that state. You can't reverse the decay and the degeneration on that tissue. Once it's there, it's there. You can manage it and slow it down so that it doesn't continue to proliferate and ultimately cause damage to our demise. But the bottom line is we need to try and make sure that we limit the inflammatory responses in our body. And the better we are at limiting that and controlling that, the less likely we are to move into a diseased state. So ultimately, this is all going on in the background. Even the healthiest individual has some level of inflammation in their system, but their body generally is coping well with it, or they are employing techniques and approaches that help manage it better. If we turn a blind eye to this and we smoke and we drink and we jolt hard and we drugging and we live life to the full, we could do that and we'll have the biggest, funnest time. But at some point we're going to pay for that because that inflammatory response is building and building and the decay is coming faster and faster and faster. Don't get me wrong. I'm not saying don't go and have a good time and don't do all of that other stuff, but moderation is the key. And being able to offset all those stresses that we throw at our body with what we need to do to try and manage what's happening in our lives. So where we see it in a chiropractic perspective is when the patient comes in with back pain or headaches or neck pain, and it's the body's first alarm system to say, I need a bit of help here. And it presents as a mechanical or physical symptom. So we can get you out of that, but it's going to come straight back to it unless we do things to try and manage or decrease that level of inflammation. And what's quite a nice analogy is that we have this huge reserve of compensation in our system. And as our days go on and life goes on, we eat away at those compensation mechanisms in order to keep us going. And our body does an amazing job at that. But as we start running out of that ability to compensate, we get closer and closer to this threshold. The minute you breach the threshold is when the alarm system starts. So that's the pain response that our body listens and says, hey, I need some help here. So the pain that comes on is a brake mechanism for your body to say, you need to do something about this because I don't know where we're going to go next, but I've run out of options to try and keep you going on this path. So often what we'll do is take a painkiller or an anti-inflammatory or something to give us instant relief, which will drop us just below that threshold, which is great because we feel good, but we haven't dealt with the issue. And it won't be long before we're back through that threshold again. So we take a stronger painkiller, or we take more anti-inflammatories, or we do something that hopefully will get us that instantaneous relief again. But again, it just brings us slightly below the threshold because the alarm system goes off. I'm going to take much to throw you back through. So I'm not saying chiropractic is the magic elixir that solves all of those problems, but certainly goes a long way to try and recreate some volume in the system before you start building back up. So if your choice of management technique is to take anti-inflammatories and painkillers, great. It's going to give you limited relief, but it's not really going to solve any of the problems. You might want to mix that with your chiropractic. I mean, that's not really an art philosophy, but if that's what works for you, great. But you do need to start addressing what's happening from a mechanical, physical perspective to try and recreate that avoid it. There's all sorts of other things you could do. We could do Pilates, you could do yoga, you could do meditation, and you can have a keyless diet, and you can get the balance right in terms of your exercise and at stress management. All of those things have a profound effect on keeping you below that threshold. And the better you are at that, the more capacity you've got in your threshold, the less likely you are to throw back through this painful road again. So in terms of your treatment, when you come to a chiropractor, our initial goal is to get you below that threshold, get you out of that pain.
Which you went into a lot of detail as to, and the large majority are speaking the correction, but is information. So if you had to put a percentage wise, you treating a patient, when you think inflammation, is that, I mean, we're talking of 60, 70, 80% of a byproduct of treating the spine, manipulation, etc. Like treating inflammation is a byproduct of what you do. Just, I don't,
So generally, from a chiropractic perspective, and this is talking very mechanically, initially, mechanically and physiologically, is that by restoring movements and function into a tissue and into a joint, automatically removes a lot of the agitation in the area. And the bigger impact is the effect that we would have on the nervous system in that area. So the minute we calm the nervous system and we change the cigarette coming off the nervous system, that also helps sedate the area and brings you out of that red zone or that inflammatory zone. So inflammation is this alarm signal that's going off in the body saying, hey, there's damage here, there's an issue here, I need help. And if we can reset the neurological signal coming off that area, that's a big one. If we can remove the agitation, the loading pattern, etc., on that joint or the tissue around that joint, that's also going to calm it. It doesn't necessarily flush out the physical inflammation that's in that tissue. So on top of what we might do from a treatment perspective is give some advice on either using ice compression, or whatever other modalities we might have to drop the actual physical activation on that tissue. So if we could bring all of those factors together, all of a sudden that area is much calmer, the patient's out of pain, and they feel so much better. Have we completely fixed the issue? 9 times out of 10, no. We've got you out of the red zone. And that's often where the problem comes in. It's like, geez, doc, you're a mess. One treatment does right as right. I'm like, yeah, okay. It won't be long before we see you again, because we actually haven't fixed the problem. We just got you out on the emergency side. So it's common thing you see, though. Yeah, because that happens often. And I get it. Like, we're all busy. You don't necessarily have that time in our day or our week to keep coming back to see the chiro. And again, please don't get me wrong. Going to see the chiro once doesn't mean you've got a lifetime of chiro facing you going forward. So there's initial treatments to get your body functioning. The minute we've got some stability and control back in the system, we would then want to see how long you can hold it for. So initially, we'd under that treatment might last a day, might last a week, it might last 6 weeks. Depends what you do in your life and in your day-to-day activities, which might dictate how well you hold what we've done. But that's how your body functions and controls your environment. So if we see in a week's time and you'd literally held 80, 90% of what we've done, jeepers, that's amazing. I don't need to see you for another 3 weeks. Let's see you in 3 weeks' time. If you fall off the weight in between, give me a shot. Come here. But we're putting a stick in the sand to see how well your body's functioning. In 3 weeks' time, we come in into just in the last 2 or 3 days. I started to feel I'm getting a little bit tight again. I'm not really moving. Great. We nailed that in terms of the time perspective. Treat you again. We know that you got close to 3 weeks. We've reinforced what we've done. I'm now going to push you to 4 to 5 weeks and see if you could hold that. Let's see how you go there. 4 to 5 weeks coming, you actually, I've actually been really good. So you've held 90, 95% what? Awesome. I'm now going to push you out to 8 weeks. Let's see how you are in 2 months' time. Let's see if your body's still functioning, looking after itself, and happy with what you bring. In 8 weeks' time, we come back, and here, the last week or so, hasn't been that comfortable. Reinforce that. You'll try 8 weeks again and see. And in 8 weeks, gee, I feel dragged up. Right, now let's go to 3 months. So you want to you'll try and find out where your tipping point is. And to be fair, doesn't matter what you or I do. You could do Pilates every day. You could do yoga, meditate, eat the healthiest diet, and no alcohol, no smoking, very stress-free life. You could do all of those things. Regardless, there comes a point we just because of our lifestyles and our habits and things like that, there's a tipping point where you'll start to revert back to this space that you were in when you first came to see us all of that time ago. But if we know that that's 3 months or 6 months, or actually you can go a whole year, you literally pop in once a year, twice a year, 3 times a year, get your wheel alignment done, get your service done, and off you go again. So what we're doing from a chiropractic wellness perspective is we're helping your body cope for everything that you're throwing at it every single day. And if we know where that point is, it's like the optimal dose of medication or healthcare that you predict. Because we know you only need to come see us twice a week, or you only need to see us once a week. Literally, we get your wheel alignment done, and off you go. Wheel alignments, and your body functions. We're not there, certainly from a chiropractic perspective, we're not there to fix you. We're there to help your body start functional properly again and doing what it inherently is designed to do. Given the right environment, your body will look after you. But geez, do we try hard to bugger up that environment. So from a chiropractic perspective, we're there just to help tweak and adjust and make sure that we can get your body to look after itself.
Doc, being a dad, being a father yourself, and having kids and screen time, and what advice do you give your own kids and the moms and dads out there with regards to not necessarily screen time, but I mean, if people generally lie on a couch too long in an awkward way, or I mean, are they, thinking back from a kid's level to screen to helping the moms and dads? Is there something that little tips or things you do or would advise, or?
To be honest, if I didn't have the golden answers to that.
Fair enough.
I mean, I think we all know the inherent dangers of spending too much time on a screen and that. But I think more specifically from chiropractic perspective, is the postural stuff that goes with that.
So every hour you mentioned, every hour take a break. So it's kind of
So there's a couple of things. Obviously, the hot topic or the hot thing that's come about in the last couple of years is text neck, and it's a real thing. And you're starting to find, I'm starting to find, you see it a hell of a lot more. And it's not just your teenagers and the kids. People on the road, they're busy. Their demands these days extend beyond having to sit in an office. They're working from home. They're on the road. As you say, with kids trying to support your wife and play sport or taking to the next lesson or whatever, you're on the phone a lot. And it's this position that is actually causing a hell of a lot of problems in a lot of our patients. And the load that comes on the neck and the upper back area is immense.
so there are things people could do, like prep shows, exercise, or
So bottom line is get off to a phone. But and I mean, understandably, those are the stresses and strains in our lives these days. But this is not a good position. We were never designed to be in this position. We were never designed to sit. So if we start off in the office situation, you're not going to get away from that. And I think often the difficult thing is when people are on multiple screens, because you're always at a slightly different angle, it makes it quite difficult. But if you've got a singular screen, it makes it a little bit easier. Just make sure that everything is kind of in your field of vision so that you're not constantly putting an excess load on your neck in my position in the necks. And we can go into the heart and the screen and where your bias is to be and all those kind of things. And they do have bearing. Again, the biggest thing is probably sitting. And it doesn't matter whether you're in a fixed chair, whether you're in the most ergonomically correct chair, whether you're sitting on an exercise ball, whether you're kneeling, whether you're standing. If you're doing it for long enough, it's going to have an effect on the posture and the loading pattern that has on your body. And there was an amazing invention, probably in the later 80s, early 90s, was the kneeling chair. It was phenomenal. And it was sort of an angulated seat with another cushion where you could kneel, you just ends up force your back to be amazing for posture. And people's neck pain and back pain disappear. But all ended up in the evening. So the bottom line is it doesn't actually matter whether you've got a standing case where you've got, where you're in the most ergonomic and correct chair, or if you're sitting on a physio ball, and it doesn't matter. If you're there long enough, it's going to cause a problem. So the advice now is try and set a reminder, an alarm, and some kind of indicator with every 50 minutes, give or take. If it's an hour, it's an hour. But change your position. So move out of your ergonomic chair and sit on the exercise ball. Near. Take a laptop to a kitchen couch or a bar counter. Heaven forbid, and sit on the couch for half an hour. I mean, nobody would advise that you should be sitting on the couch with your laptop. But if it's for half an hour and it's a change of postural environment, it's not the worst thing you can do. And so that's probably the biggest advice in terms of posture. That also extrapolates then onto when you're on your phone. And if you need to be on your phone, if it's a document that needs to go out, or if it's a bit of a longer period of time, you know you're going to be working on something, rather use your computer, use a laptop, or use an iPad that you can prop up and you can do it in a position where you're not putting excessive strain and load on the tissues of your neck and your upper back. And that's critical. Because there's nothing you or I could do or advice that I can give you that's going to change that loading pattern other than don't do it.
Can nerve compression in the spine lead to symptoms elsewhere in the body, like tingling, numbness in the arms or legs?
So more often than not, the answer is 100%. And we'll often use the symptoms that patients present with to try and trace that back to the actual nerve root. So there's often a direct correlation, particularly when patients talk about tingling in the arms or the legs or a certain referred pain pattern, that'll often relate back to a specific nerve. And it doesn't just necessarily mean I've got tingling in my arm. It's if you've got tingling in your arm, is it something specific? So they might describe a sort of tingling along the back of the arm, maybe down towards that index finger and thumb, or really we're sort of thinking potentially C5 and C6, which are the lower two notes coming out of the base of the neck. And that would be a typical sort of referral pain pattern for that nerve. And similarly, for every nerve on the body. If we just go to lower back, so very typical referral patterns, it's to say a front shin or across the top of the foot may indicate there's an L5 or S1 nerve involved. So there's often a direct correlation from the actual nerve root itself to the symptoms that the patient's got. The other thing that that may also be related to that is you can get referred pain from muscles or from certain tissues. So if a muscle's been overloaded, or there's a tissue that's under excessive stress and strain, one of the byproducts of that is it might create a referral pattern. And tracing that referral pattern may well indicate, is it coming from that tissue or that muscle, or is it actually coming from the nerve? And often there'll be a connection between the overload in the muscle or that tissue causing a referred pain and a completely different nerve. There'll be a connection between that nerve and the muscle. But say, for example, where I've said that there's tingling down the front, the shin and into the top of the foot, that may well indicate there's an L5, S1 nerve root issue. You may well present with a similar pattern, but there's actually a trigger point coming out of, say, your group B isthmus. Now, that might be coming from L4. So L4 would innervate your gluteus medius, and it may well not be L5 and S1, although the pattern that you're presenting with could be very similar. So part of your assessment clinically would be to ascertain, is this an L4 issue that's creating an overload in the glute medius, which now is a trigger point creating a referral pattern, or is this an L5S1 overeat issue that's creating that same referral pattern? And that would you pick up through your clinical assessment. And the treatments, when we're looking at the specificity of what you're manipulating chiropractically, is very different. Are you manipulating L4, or are you manipulating L5S1 to you be able to nerve recuperation orientation?
Doc, is there a correlation, or what is the synergy or the understanding of the tingling and numbness that we feel in our body?
So there's a lot of things that can cause tingling and or numbness in the body. And there's systemic issues like diabetes, for example, can give you tingling and numbness, lower part of your legs or into your hands. And there could be a deficiency, sometimes magnesium deficiencies cause tingling into your hands.
Out of all the different deficiencies, and when you walk into a desk game, I mean, there's, 5,500, like top of mind, two, three very common things that people are deficient in that you picked up.
What are they? So a big one, interestingly, and there's two probably big ones. Inflammation in this kind of you mentioned is magnesium and vitamin D. Now, interestingly, we don't get a lot of magnesium in our soil already. So our food isn't very rich in magnesium at all. So magnesium is a good supplement to take generally. Often goes with cramping. So if you suffer with cramps, one of the first go-tos are magnesium. In the morning, at night, when you wouldn't be remiss if you really do suffer from taking morning and night. Magnesium generally helps calm cell function. So it's quite a good one to take at night. It will help with your sleep. And you could get away with going to a pharmacy and getting your magnesium, and it's water soluble. So, if you get it wrong, it's not a train smash.
And when you say water soluble, is there a difference between the tablets and the effervescent that you know?
And let's say water soluble as a vitamin. The magnesium that you don't need, you're gonna pass already. So going such in your system.
So that
Can't advertise. Well, I'm gonna say I can't advertise, but it gets passed through your system, which that means. So magnesium is a good one, and it's a good one to take just for general cell health. Okay. The other one is vitamin D. Interestingly enough, you would think in this country, most of us had some kind of outdoor exposure on a daily basis. Outdoor sunshine, interaction with sunshine with our skins, melatonin, vitamin D, we're golden. But we've realized, probably over the last 20 or 50 years, there's a lot of symptoms that patients present with are as a direct result of vitamin D deficiency. It's since we've identified that, there are a lot of treatment protocols that now focus on getting vitamin D levels up. Now, tell us, so it would be very remiss of me to say to you, go to your pharmacy and get yourself a reshape is okay. Simple blood tests will indicate whether you're deficient or magnesium or vitamin D. And I would encourage you to do that before you go out there and just start helping yourself to vitamin D and magnesium. And that's why it's so important that you engage with a healthcare practitioner who can look at these things and give you sage advice on how much you should be taking and when you should be taking.
What is it at the high level sports athletes you deal with? Looking at blood tests, are you queued up and advise your patients, John, Samantha, you low on this vitamin that is affecting your sports, and is this
so they will come through quite easily in their bloods. And what's interesting is that you'll get an indication of where they're sitting on the spectrum, and whether their levels are within the normal ranges or whether they too high or too low. And ideally, we like to try and keep things in a median. And
do you get a vitamin D, as in sunshine, vitamin D supplement?
So you get vitamin D supplements, vitamin D3.
Yeah, forgive me. I assumed that the sunlight. So that's when we get a large source of that is from sunlight.
And one of the arguments these days is we spend a lot of time in that fluorescent light, a lot of time indoors. If we do go outdoors, we're either up a factor 50 or we put some kind of sun protection factor clothing on. So we're not getting as much natural light into our bodies as we used to. And again, that leads to a little bit of potential vitamin D deficiency. But we get it from our foods, from seeds, from oils and things like that. But you can supplement with it with vitamin D3. And again, that's a very simple blood test, and it's something that's worth monitoring because, as I say, we didn't pay much attention to this 15 years ago, and a lot of patients were suffering from vitamin D deficiency, and it was the furthest thing from our minds. Because, as I say, we're a fairly active outdoor population. Why would we be vitamin D deficient? But it is a reality. But I need to stress that just don't go out there and start throwing for your D down your throat and maybe it's right.
It's sort of just interesting. Out of all the 5,000, you mentioned those two, which is immense.
But visually is very common, and there's a lot of common that ever gave it credit to. But you'll go a long way in your general health to make sure that you're taking sufficient magnesium and your vitamin D levels are within your more normal limits.
Doc, how can chiropractic adjustments uplift sciatica?
Excellent question. And it often comes up. Patients will present with sciatica, which is great. Sciatica is a term. It's not a diagnosis. Okay. So sciatica describes a pain pattern that usually starts in the middle of your buttock. You go straight down the back of your leg. And there are a dozen things that can cause sciatica. Most of it relates back to nerve reef come off the base of your lower back. And it could come anywhere between your lumbar 1 down to your lumbar 5 and even into your sacral nerve roots. We're all slightly different. Our anatomy is all slightly different. So your sciatic nerve, which is that nerve that runs down the back of your leg, can be made up of any number of those nerve roots, from L1, 2, 3, 4, 5, down into the sacral 1, 2, 3, 4s. And any disturbance, loading, damage to any of those nerve roots can create sciatica. Any kind of compression on the sciatic nerve can create sciatica. And there are a couple of pinch points that commonly can create that sciatic referral pain. And those are the kind of things that we'll look for when we assess and we're diagnosing one patient. If it is indeed coming from the lower back or the spine, an adjustment to any of those levels or multiple levels, reversing any kind of entrapment or inhibition on that nerve will make a huge difference on that sciatica. It may not be coming from the spine itself. It may be coming from a compression further down that sciatic nerve, somewhere the pelvis, as it's exiting the pelvis and going down the leg. If we can identify that, we can release the tissue that's entrapping that sciatic nerve and give great relief from the actual sciatica itself.
What is sciatica in the first place?
It's a description of pain that comes out of the center of your bum, literally straight down the back of your leg. And it could go just the back of the thigh, go to the knee, it can go all the way down to the foot. Depends what's compressing the sciatic nerve or any multiple nerves that make up the sciatic nerve. So as I say, sciatica is a description of a pain pattern. It's not a diagnosis. We would then need to clinically assess you and work out what it is that's causing the sciatica and treat that.